Good evening, everyone. I cannot believe it's the end of the week. Wow. So here we are one more time. Thank you for those who are coming back again tonight. Today, I went to my doctor's appointment to get checked out, and they told me that every year they normally update their consent forms, their HIPAA laws, all of that. And so they asked me to review everything and to sign it. And so it was a lot of forms to review. Interesting in the information was what I would need to pay if I missed my appointment. It was $25. If I missed a surgical procedure, it was $300. And if I missed a consultation, it was $50. And all of these things were part of this consent form. And I, of course, reviewed it and signed. But what I want to talk about tonight is informed consent. And this might spill over a bit into tomorrow. I want to talk about informed consent and birth plans. We'll pay attention to birth plans tomorrow, because birth plans are actually a part of your consent forms of what you are expressing for what you want for your birth. So I'm going to go to my PowerPoints just again to make sure I'm hitting the right points and to make sure that you have the information that you can refer to. You can always come back to this video, download it, do whatever you need to do to have the information you need. And so here we go. I'm going to put them up. So, the question of it is, do you know what you're signing for real? What I'm noticing is that for pre-admission consent forms, and these are the forms for the hospital that you register with for having your baby. If you are having a home birth, some of those practices may ask that you pre-register with a hospital. And that means that you will have signed all of these forms. But I want you to also make sure that you really understand what you're signing. And we're going to talk about this tonight. Do you know what you're signing? Why are we talking about this? In the earlier episodes, I think it was the second and third episode, I talked about racism in medicine. And I talked about racism in medicine to particularly help you understand the background and to why it is so important for people of color to know what they are signing. We're going to talk about some of those examples that were discussed, and you can go back to those episodes to hear more in-depth information. But this issue of not having some say so about what happens to your body has been going on since the time of slavery. Here we had people who were given medications, more not so much for healing, but sometimes for entertainment. We have for GYN, gynecology care, where we had 11 slave women who were experimented on so that they could determine the surgical procedure for the treatment of fistula. And they had no pain medicine, even though anesthesia was available. I'll advise you to go back and look at these episodes. Henrietta Lack at Johns Hopkins in the 1940s had cervical cancer. And her tissue cells were taken from her without her consent. Of course, you have a biopsy to determine are your cells cancerous or not. But it went beyond that. It went to where, because of the character and nature of her cells are seen and have been awarded as medical breakthrough, modern medicine medical breakthrough. And do you know her family has yet to be paid? Yet to be paid. Medicaid in the 60s and 70s did sterilizations on over 100,000 women of color without their knowledge. And that is why now, as I mentioned before in those earlier videos, why now you have to wait 28 days if you're going to have your tubes tied or have any sort of sterilization procedure done. I would assume, I've never used it for men, but I would assume that if men wanted to have a vasectomy done using Medicaid to pay, that they too would need to wait for 30 days to have that procedure done. Why? Because of all that happened in the 60s and 70s. That's why that consent form is there now. The Tuskegee study that happened for over 50 years, men went untreated, even though penicillin was available. Again, listen to my earlier videos to get the full story on this. So I did those videos particularly to help you understand what happens when you don't have an understanding of what is going on with you, when others feel that they have the right to your body to do whatever they want. So this is why informed consent is critical. As my mama told me when I was growing up, and this is not just for consent forms, but if you go for a loan, if you take out a loan, if you having anything doing with money that you're needing to sign for, you never, speak it again, never, Never, sign a form that has any blank lines that have not been filled in. You never, ever sign that. Why? Because once your signature is there, if you did not sign, if you left it blank, it could be for anything, even with a blank check. Although we probably don't use checks as much now, but even you sign your name to a check and it's not completely filled out, gee whiz, that could be for who knows how much money for whomever signs the puts in the information in the blanks. Same thing with when you're getting services, same thing when you get a loan, same thing when you're signing a consent form for care. You never, ever, ever, ever sign a form where all of the blanks are not filled in. And if you see that they're not filled in, you can just exit out. Make sure you do something to make sure that line is not left blank for someone else to come in and to write something there. If you don't understand what you're reading, you ask questions. And you ask questions until you understand. You can take those forms home with you. You can do whatever you need to do so that you have the time to be able to read, digest, think about, ask questions until you have a full understanding as to what you're signing. I want to give a little bit of caution. I have looked at some consent forms from hospitals in my area, and I'm noticing, I mean, this is done to be efficient, where a lot of forms are now, you go in for your doctor's appointments, you go in for any kind of consultation appointments, you go in for a hospital where it's planned, they are sending everything to you by email that you can download, you can look at it, you can sign, send it back. Well, there are some things to think about with informed consent. Listen to what I'm saying. Informed consent. There's a process. There should be a conversation about whatever that proposed intervention. During pregnancy, you should be signing a consent form for lab work that's done, like when you go in for your preconception visit that we talked about early in these episodes. When you go in for prenatal care, usually you will sign consent forms for care. When you go into a hospital for birth or home birth, whatever, there's normally a consent form for care. Do you know what you're signing when you're signing that consent form? Do you realize that you're signing for all types of blood work, including HIV screening, syphilis screening, gonorrhea screening, all of these things you're signing for? And I remember when the HIV started, I was working as a midwife in the city hospital, And at that time, there was usually the request to draw your blood for HIV. And there was also this very long questionnaire and history taken related to HIV. Because of the prevalence of HIV, it's now been included as, what shall I say? You have to opt out of having that test done. What do I mean by opt out? Meaning that it's included in the list of tests that are drawn. And if you don't want that drawn, you need to say, I don't want it drawn. You need to opt out of it. So you should know what are all the lab tests that are being done when you go for a preconception visit, when you go for your prenatal appointments, when you are admitted into the hospital. You should know all the labs that are being requested and drawn. So that should be a part of the conversation about what is going to happen. So this is not just for a surgical procedure. This is for regular care. There should be negotiation. Is there anything in that list that you have questions around that you may or may not want to have done? Negotiation means for you to be able to understand what would be the risks if I don't have this test done. What are the benefits if I don't have this test done? There should be time for you to be able to reflect on and to think about all of this information that has been provided in this conversation. And if there's any kind of debate does not always mean an argument. Debate can mean a healthy exchange of information between you and the provider so that there is good conversation. Debate, as I mentioned, never sign anything that you do not understand. And so this debate is to be able to learn more, to ask questions, to get whatever knowledge you need so that you understand what you're signing for. This is the process that should happen. A lot of times I feel that we are very rushed. You walk into an office and they want the consent form done before services are provided. A lot of offices will provide these things online. And my recommendation to you is to download these consent forms, review them in time before you go in for your appointment, so that if you have questions about anything, that you can ask those questions, and then you can sign the consent form there in the office if you had questions that you needed further conversation with the provider about. Elements. Tomorrow, I'm going to put up a couple of consent forms, and we're going to look at, do these elements appear? In that consent form, it should talk about what is being treated. What you're treating during regular prenatal appointments is very different than what you're treating when you enter into a hospital or have home birth. It's different. You're now dealing with labor care, all right? You should have developed a treatment relationship. And when we talked with our dads last night, Michael and Halase both talked about, because they were there doing prenatal appointments, they were able to establish a relationship with the provider. So now when it came time to make decisions about what needed to happen with their wives, that they were aware, they understood, they knew what was going on. And Halase talked about how first he kind of let his wife make decisions because she was a medical provider. But then he decided, no, I want to learn some more about this myself. And so he began to ask questions. And I want to encourage everyone, the moms and the dads, to ask questions. Just because someone says, oh, we're going to do this, that, and the other, do you understand what that means? Do you understand what is that treatment? If they're doing a test as a means of diagnosis or to treat something, do you understand what is that diagnosis? Do you understand what would be that treatment? This is going to take us back to understanding those risk factors that we talked about earlier in earlier episodes. You will have a history and an examination, which is going to provide information. There will be treatment and test recommendations based upon what that history is, what that physical exam. And you should not be surprised if you have looked at your own family history, if you have looked at your own history, present and past, all of the different items, your pregnancy history, your sexual history. You should not be shocked when it comes to what happens in the office with the doctor, because you know yourself. You are the one to guide your health care. You are the captain. And so you are giving consent because you already know. You already know about your body. And then there's a disclosure of pertinent information. If I do a test, it's going to have such and such percentage of being correct or being accurate. Some of the tests that are done for antenatal testing, what do I mean by that? There's some genetic testing that occurs, and they're not 100%. It should be explained to you what is the percentage of accuracy for those tests. So even if a test is, say, 90% accurate, there's 10% that it's not accurate. You should be explained that. You should know that. There should be you should know if I have an amniocentesis done, what is my risk? A lot of tests are not risk-free. You need to understand what is the risk related to that. What is the percentage of this or that? And what is the percentage where it's no issue at all? You should know, even if it's 1%, you should be receiving that information. There should be the exchange of questions where with any of the information that has been provided to you, that you feel free, you must. I want to emphasize this. You are paying for this care. No one is paying you to come for prenatal care. No one is paying you to come to have your baby with them, whether you are at home, birth center, or hospital. No one is paying you. You are paying these providers. You are paying them as consultants and experts to give you guidance as you move through your pregnancy, through your birth, and after you've had your baby. You are the captain of your ship. I want to say this again. You are the captain of your ship. You are paying for this care. Therefore, you have every right under heaven to ask whatever questions you need to ask. The problem with people of color is that they are ignored. They are ignored in the healthcare system. And sometimes you need to kind of give a gentle reminder that, excuse me, but I am paying for the service, and therefore I do have these questions that I really need to have answered. And you do have recourse, as was noted from a midwife working in North Carolina. If you don't get your questions answered, you take it to the next level. Take it to the next level. And then once all this has happened, then you can come to an agreement on what should be going on. This is when you now are consenting in an informed manner, not just signing a paper because it's put before you and it needs to be done as a part of the routine of the hospital. Now you can say that you have given informed consent. And this is what we're aiming for. I want to talk about cesarean section. I worked as a nurse midwife in our public hospital, and I was the one responsible for having patients who were being admitted under me to sign consent forms. And I advised them to not sign the consent form that would include cesarean section. Why did I do that? Because my feeling, this is my personal feeling, is that when you have signed some of the forms that we'll see, that it's so general and so broad that it's kind of cesarean section if the physician thinks it's needed, as opposed to coming back to you, helping you to understand why you need to have major surgery. I want to emphasize that again. Cesarean section is major surgery. That when you have consent for cesarean section done separately, that it will include the elements that we talked about before. What is this treating? Why do you need to have it? What are the implications for cesarean section? The risks, the benefits, what could go wrong, what doesn't go wrong. All of this should be explained to you. I also want to say to you, based on the information I shared in an earlier video, looking at hospitals, do you know the C-section rate? Do you know the baby-friendly rate? When you look at the hospitals and you look at cesarean section rates, and I'm going to talk about hospitals where I live, the rates go anywhere from 11% to 42.2%. I'm going to say to you, something's wrong. Something's wrong with that. What it says to me is, what is the real reason for why the cesarean section is being done? We can go from 11% at your best hospital. Anne Arundel Medical Center was seen as one of the best hospitals in the United States, which is 30 some miles away, compared to another hospital that's 30 some miles away, where the cesarean section rate is 42.2%. They are not listed as the best hospital. They are not. I want to know, why is there such a difference? I don't think that it's that much of a difference in the women living in this part of the country. And I want to also say that that means that at least 60 to 90% of women don't need cesarean sections. So it's important to understand why. Why is it needed? And the other is that most cesarean sections are not emergencies. They are not emergencies. When I say this, I'm talking about the kind of cesarean section where it's like, oh my God, we got to go busting through the doors. We got to get into that delivery operating room. Like, we don't have time for a conversation. That happens very, very limited times. I worked as a midwife and nurse in this area for over 20 years. And I can count on one hand how many times we needed to go busting through doors because it's such an emergency that we don't have time to talk to the family and get a consent form for cesarean section. I find it interesting that anesthesiology will come up and get a separate consent form for epidural anesthesia. There's time for that. So something to think about, something to be aware of, something to know about as you sign consent forms. So this is what I have to share with you tonight in regard to informed consent. Tomorrow, I'm going to put up 2 different forms and I'm going to illustrate to you what some of those differences are. How one consent form can kind of almost gives that hospital full access to your tissues, your blood, everything. And I also want to say it's okay to X out things on a consent form. It's okay to write in things on a consent form. When my father had surgery, I did exactly that. So I want to, again, thank you for your time for coming tonight. Sunday, we are going to actually have a physician with us who's going to talk about managing your doctor. He's the author of that book. What a privilege to have him be able to come and talk to this audience. And he's a physician. He's talking about managing physicians. So there must be something to it if you have a physician saying you need to come and learn how to manage your physician. So, okay, everyone, this has been a little bit longer than normal for our episodes. I want to thank you for the time. If you have found the information to be informative, that you've liked it, I'm going to ask you to like. I'm going to ask you to also subscribe to my channel. I'm trying to put together playlists that where of the episodes I've done so far, that they kind of go together, and you can then see what is the connection with what I've done with some of these episodes. I also would ask you to subscribe to my channel. When you subscribe, you will get notification of new live events that will be upcoming. And to share, as I say, share it with your mama, your sister, your dad, your brother, your aunties, your uncles, your cousins, your nieces, and your nephews. Thank you so much for your time again tonight, and the very best as we enter the weekend. So have a great Friday, and thank you again. Bye-bye.